Hi, so this is Becky Wall's video about movement patterns. So shoulder joint. So abduction. So it is above the shoulder level and the scapula is located and elevated upwards. For adduction, it results in the depression and rotation downwards of the shoulder blade. This occurs in all planes and it is in the axes of anterior, posterior, medial, lateral, and longitudinal. For lumbar spine, lateral flexion. So the planes and axes is the frontal plane, which means that the anterior posterior axes is where it occurs. Lateral flexion. So head moves laterally towards the shoulder, thorax moves laterally towards the pelvis. Shoulder girdle, so protraction. So movement of the scapula laterally away from the spinal column, as in reaching for an object in front of you. Retraction, so movement of the scapula medially towards the spinal column, as in bringing the shoulder blades together. This occurs in the transverse plane, so it's in the longitudinal axes. Knee, so flexion. So bending or decreasing the angle between the femur and the lower leg. Extension is straightening or lengthening the angle between the femur and the lower leg. This occurs in the sagittal plane, which means it's medial lateral axes. The hip. So lateral rotation. So when you rotate your thigh outwards so that your foot becomes closer to your other foot. Medial rotation occurs when you rotate your thigh towards your inner body so that your foot moves away from your other foot. This occurs in the frontal plane and in the anterior posterior axes. Tensegrity. So the main focus is about tension and compression and the balance they share in the formation of structure. So in reference to the body, the core of the abdomen of the body is the easiest example of tensegrity. So it assists in breathing and is bounded on all sides by bony structures. As the human body breathes, it causes the thoracic cage to expand and contract, which also results because of the diaphragm. So basically, all in all, it mobilizes the human skeleton.